We will go to line one. Thomas from North Carolina. I'm Dr. Mona Lisa. How can I be of help?
Hi, Dr. Mona Lisa.
Hi, how are you?
I'm good. I've been listening to you for years, but for whatever reason, I'm never listening live when you're talking about something relative to me, so I called in today.
Okay.
I've most commonly throughout my life, I've always had poor dental health for whatever reason. Whether I keep up on the healthy habits or not, it's always seemed to be that I have some kind of problem going on.
You understand the cofactors that I talked about.
Yes, I do.
That it's not just about brushing and flossing.
Yeah, and I totally think that has something to do with it because, I mean, it feels like it's some kind of self-sabotage.
Well, it's not just that it's your fault. It's that there might be a constitutional immune system dysfunction that increases your chance toward bacterial overgrowth and plaque development. You know, there are some people who get canker sores. I read a lot about mouth infections last night because that's what I do the night before as I read about today's show. And there are a variety of infections where you can get mouth sores. There's pemphigus vulgaris, where a person can get a variety of mouth sores. There's lichen planus. And there are a variety of things called canker sores, which can last 1 to 2 weeks. They're painful. They have redness around them. And they may or may not be related to biting on your lip. But they respond to steroids. And a lot of people who have autoimmune problems tend to get those sores under stress. There are a variety of systemic illnesses that can also show up with a symptom or two in the mouth. And dental health has seemed to lag behind that understanding. They've begun to understand the connection between gums and heart. But ancient Chinese medicine looks at the coating of the tongue and diagnoses a variety of disorders just by looking at the moss, the redness, the paleness, dry, wet, and so on. So it's not like if I brush my teeth, I remove the bacteria, I'm quick to be sailing. It's not that. It's that it's an example of immune system, first center, hormones, second center, blood sugar, third, fourth, cardiovascular health, and fifth, what you're doing structurally with your mouth. So it's not just your fault. But the first thing I see, Thomas, how old are you, Thomas?
25.
Is I see that you're very porous or sensitive to people around you. So it makes you very sensitive to have people spend a lot of time close to you. I see this makes you like a monk, someone very spiritual, but it's not exactly like you're going to be the traditional male with 2.5 kids in a ranch house with a Volvo. Do you understand what I'm saying?
Yes, totally.
And so your immune system, first center, when you don't feel safe and secure, your immune system, whether it's in your skin or your gums, which are like skin, are going to be hyper reactive. If you don't feel safe and secure, you're more likely to get skin problems or gum problems because your immune system is hypersensitive to people and bacteria in your environment. Do you understand what I'm saying?
Oh, yeah. I've always been really sensitive. In fact, you've mentioned on your shows the rejection sensitivity and stuff.
That's what I'm talking about. Thin skin rejection sensitivity. So you're more likely to have skin issues and gum problems. I look at your head. I see problems with focus, attention. I look at your neck. I look at your thyroid. I look at your heart. I look at your left lung, right lung. I see a male relative who is emotionally gets unhinged that you watch this. At times I saw in the past shortness of breath, increased susceptibility of respiratory allergies. I look at your esophagus, stomach, liver, gallbladder, colon, and rectal areas. I see a red dotted pattern where your esophagus and stomach come together. I can't figure out if you have excess bacteria there. I just see a red dotted pattern there. I see at times changes in bowel movement frequency. I wonder if your skin is sensitive to the sun, certain foods, or things in the environment. I see nervousness in certain situations, heights, closed-in spaces, or public speaking. Can you please tell me your health concerns?
Well, just about most of what you mentioned. One of the big things is, like you said, the bowel movements. I self-diagnosed IBS, or there's constant constipation. I'm morbidly nervous when it comes to public speaking. I do have shortness of breath on occasion. What you were saying earlier about canker sores, I have those.
What I want you to do is learn mindfulness. Mindfulness meditation to calm your immune system so your GI tract, your mouth, and the skin in your mouth isn't so overreactive. Do you understand?
Yeah.
I want you to talk to your doctor about taking 5-HTP, 100 milligrams 3 times a day, and passion flower or lemon balm to calm your digestive tract. I want you to consider many of the solutions we're going to talk about at the end of this show. Vitamin C, up to 3,000 milligrams a day. Sailors used to take it when they went out to sea to stop bleeding of gums. It's an antioxidant and helps repair connective tissue. You can get it in grapefruits, oranges, kiwi fruits, mangoes, papaya, strawberries, but avoid chewable vitamin C as it's acidic and it promotes teeth decay. You could do vitamin D. It's anti-inflammatory. It also helps with gingivitis. And a study at Boston University showed an association between low vitamin D levels and gingivitis, which is an inflammation of the rim of the gum. You might try to get 10 to 15 minutes twice a week of sun exposure or just take vitamin D. But stress reduction, that's your anxiety. Increasing in stress increases plaque accumulation, or those fossilized bacteria in your gums. And that was a study done at the University of Dusseldorf. So the idea is they did a study showing that students after an exam had more plaque in their teeth than students who didn't. So learning the relaxation response or mindfulness meditation or diaphragmatic breathing might help with your anxiety, but decrease plaque growing in your gums. Okay?
All right.
You take it easy. Thank you so much for calling. When we come back, you're going to learn the mind, body, and medical solutions to gum issues. You're listening to Intuitive Health. I'm Dr. Mona Lisa.